I think I've always been interested in the sciences because I thought about med school for a while. And I always was very good at science and math. My mom probably could have been a nurse because I watched her care for other people. The way that she would talk with people and treat them and care for them is being out and about is somewhat similar to what we do in healthier communities. There's more depth to it, and I think that she just did that intuitively and knew that was the right thing to do when people were in need. When I first got out and started practicing nursing, I liked caring for the patients, have a lot of good memories about that. I was very frustrated with the profession because I didn't understand it. And it was actually during my classes at community college that the instructor had someone come through that was a nurse who had a doctorate degree. And I just thought that was really very interesting. So I didn't know that at that time that would be probably the path that I took, and that was the path that I ended up taking. I ended up here at Healthier Communities because I was the nursing director at DeVos Children's Hospital. There was a child who was admitted to our floor that was in for a skinned knee that ended up to almost be an infection in his bone because no one had attended to it. So we were very busy and patient, and I wanted the social worker to check on his family situation because the nurses were saying that he couldn't get a hold of his pain, that they were trying what they could, and he was just very sad and weepy, and his mom wasn't around, and I couldn't figure that out where the mom would be. And there was a trauma in Peds ICU, so she was busy, so I went to the chart, looked up where the kid lived, found out that it was 2 blocks away in the Coit neighborhood, and walked over there to try to find the mom. And what I found was a single mom working 2 jobs and trying to do her best by kids, and thought that he was safe there and being attended to, and she was working hard. I'd gone to the school, Coit School, to find out why nobody really checked on this kid and why his skin knee got so bad. And that ended up that there was 11 school nurses for 27,000 children at the time. And it just seemed that we could do better. So, long story short, I ended up putting a program together with a school nurse, Stephanie Painter, that started out putting registered nurses and community health workers in schools to bring health care to urban kids. I've been in Healthier Communities for 7 years. When they originally started, there was no place like this around the country. They got the department up and going, so the next step that I feel like I was able to take it was to put some strategy behind it. So what we've been able to do is lay an infrastructure with a model called the RN and community health worker, and that's where our big infrastructure programs are, in schools, in churches, and in the neighborhood. So it's getting folks to, one, trust you, and then welcome you in. It's very inspiring to go out and see the programs that you have and people talk about what's happened for them, so that they're able to kind of fix that piece of healthcare that they couldn't figure out or navigate or access, and then move on with their life. That's the neat part when we're out into these programs. I think it's incredibly important that we continue to highlight the gifts that women bring in business or in the community. Just in the world of healthcare and nursing, it's changed dramatically. Even in other professions too, things that you wouldn't typically encourage a girl to do. And I think the YWCA, just cheers for them for highlighting that and encouraging it, because those are the kinds of programs that make a difference.